Tonight, when your great-grandmother felt sick, she didn't go to a hospital, she went to a barber shop. A man in a stained apron pressed a sharp lancet to her arm. He let her bleed slowly into a porcelain bowl. The local medical college approved of this. She thanked him and walked home feeling lighter. We call that insane. But here's the strange part. The truly insane thing is just how much of it actually worked. Take a breath right now. That breath traveled through your nose, was warmed by tiny bones inside your skull, and reached your lungs through a sheet of muscle you never control on purpose. Your body is a small, strange machine, and yet for almost all of human history, when this machine broke, the cure was a wild guess. We've always been told that ancient medicine was superstition, chanting, spells, drain the blood, scrape the bone. We laughed at our ancestors, then we dug up their work, and we realized we should not have been laughing. The year is 2655 BC, more than 4,000 years before your phone existed. On the banks of the Nile, a man named Imhotep served as physician to Pharaoh Djoser. He is the world's first physician known by name. He did something no other recorded human had done before him. He treated patients as if their bodies were machines. He diagnosed, he observed, he wrote down what worked. A few centuries later, a scribe copied a textbook. It still exists. It is called the Edwin Smith Papyrus, named after the Egyptologist who bought it in 1862. Inside are 48 cases of injuries. Case 6, a wound to the temple. The physician writes down what he sees with eerie precision. He watches the patient's eyes twitch as he tests the hearing. He watches how the bandage tightens when the jaw clenches. He is describing a broken connection. He is describing your nervous system. He is doing this 1,500 years before Hippocrates was born. So the Egyptians weren't chanting over the sick. They were keeping the first case reports. But now comes the part that lives up to the title of this video. For 5,000 years, in cultures separated by thousands of miles, from Neolithic France to the Inca of Peru, healers scraped a circle in the bone of living human skulls. The technique has a name: trepanation. The earliest example we have from a burial in France dates to around 6,500 BC. Hundreds of skulls have been catalogued since. And here is the part that should stop you. Many of them show a feature we did not expect. The bone has healed. The patient survived. Some of them survived for years. A 2007 study led by Kay Han cataloged more than 400 Inca skulls. 250 of them showed clear signs of healing. That is roughly a 62% survival rate. For surgery on the skull without antibiotics, without anesthesia, without the germ theory of disease, that is not random cruelty. That is medicine. And here is the strange part you didn't ask for. The ancient healers were not entirely wrong about why they did it. They believed that headaches, seizures, mental illness came from something trapped inside the skull. Let it out, and the patient would heal. Today we call that a superstition. 200 years ago we would have called it a reasonable theory. Now we know the truth. The head pain of a migraine really does involve swelling around the brain. The pressure is real. So the ancient doctor was treating a real problem with a primitive but not entirely wrong model of how the body worked. Now consider the practice we did less than 100 years ago. In the 1940s and 50s, an American surgeon named Walter Freeman developed a procedure he could complete in under 10 minutes. He called it the transorbital lobotomy. He used an instrument that looked, by his own admission, like an ice pick. He tapped it through the thin bone of the eye socket with a small wooden mallet, and then he swiped it sideways through the brain tissue. No operating room, just an office. Sometimes on house calls. At his own count, Freeman performed more than 2,500 of these procedures in 23 states. The medical establishment approved of this. For almost 20 years, the medical establishment approved of this. In 1949, the Nobel Committee awarded its prize in medicine to a Portuguese doctor named Egas Moniz for inventing the original version, less than 100 years ago. The Greek sleep temples at least let the patient lie down first. So when you take your next breath, that warm, filtered, beautifully engineered breath, remember this. The medicine you trust was not invented in your century. It was invented and reinvented and re-forgotten and reinvented again by every generation before you. And the most insane thing about ancient medicine is not that it was insane. The most insane thing is that some of it worked. And the most insane thing of all is that your great-granddaughter will probably look back at the medicine we trust right now the same way we look back at Imhotep.